Often people ask what the difference between a dermatologist and a cosmetic physician is. I'm a cosmetic physician. I treat the cosmetic side of skin, making it look better and healthier. Dermatologists only treat skin disease. There is some crossover, of course, but as a cosmetic physician, we're interested in the way that your skin looks to make it young, healthy and vibrant. Dermal fillers, in general, will last different amounts of time depending on what part of the face they've been injected. Fine lines in the cheek area where there's not so much movement, the filler tends to last 1.5 to 2 years or even more. Around the lips that are highly mobile and quite spongy, dermal fillers tend to last somewhere in the region of 10 to 12 months. People tend to return for their cosmetic injectables, whether it's a bit of dermal filler or a muscle relaxant, more associated with what they're doing in their lives, around times of birthdays, before travel, before special occasions, rather than sticking to a strict timetable of every 4 or 5 months. We do provide a numbing cream here at Skinovate. Not all the clinics do, but we have a very strong one available for those who are feeling a little sensitive. The needles that we use are so tiny and the discomfort is very minimal and transient, but if you want a numbing cream, it's here and it's free and it will help. Cosmetic injectables are among the commonest treatment that clinics like mine provide. We certainly recommend that on the day after you've had your treatment that you do not exercise. We have placed very tiny needles, usually into the muscle and sometimes the skin, and bruising can be a problem, and so can spread of the product. We really want you to have a restful day for the rest of the day, not have any facial massages, don't do any heavy lifting, and you can go about your normal day-to-day activities, but no exercise in general after cosmetic injectables. The safety of cosmetic injectables, muscle relaxants and dermal fillers in pregnancy and breastfeeding are very unproven. We do not perform those procedures on women trying to get pregnant or certainly pregnant or breastfeeding women. We recommend that when you stop contraception and you are trying to have a baby that you don't have any cosmetic injectables whatsoever because we really just don't know the full risks. When having a dermal filler injected into your lip, it can take a couple of days to settle down. Usually it swells up a little bit for the first 12 hours. Often the next morning when you wake up, the lips feel a bit tight and are a little bit tender to touch. So we recommend that you don't have anything amazingly important to do the very next day. Most people can go to work the next day and some lipstick covers their lips, in the case of the ladies of course. In the next few days, the swelling does come down a little bit, so don't get too used to your lips the next day because the swelling will come back a bit. And we tend to review people 4 weeks later and put a little bit more product in if it's the appropriate balance for them. Some of our treatments here can be used in combination. 2 of the commonest ones that we do are muscle relaxant injections and microdermabrasion. They can be done on the same day, but guess which one we would do first? We would do the microdermabrasion first, because otherwise that would be like massaging the muscle relaxant. So you come in, you have your skin buffed and polished with the microderm, and then you can have your muscle relaxant injections, and off you go. After an injectable treatment, some people are quite worried about whether they can touch it and in what way. If we're injecting muscle relaxants in the upper part of the face, we don't want you to touch them because we don't want the muscle relaxant to move beyond where we've put it. Otherwise you could cause a heaviness of the eyelids. Dermal fillers on the other hand, and the common type that we use, can be massaged because as you move and your face expresses itself, it's good for the dermal filler to be able to be massaged back in the surrounding skin until it integrates with the skin. So muscle relaxants we don't massage and dermal fillers we do.